Please join me in a brief word of prayer. Father God, I come to you today with a heavy but hopeful heart. Millions of Black women, women that look like me, like my mother, like my grandmother, like my millions of Black women are dying needlessly, senselessly, while trying to deliver sacred life lights into this world. Lord God, this hurts my soul because I know that this is not the world that you've intended for Black women and their children. You tell us that you have great plans for us. In fact, that you have plans that will not harm us, plans that will give us hope and a future. And so I ask today, knowing that we have that future at hand, this omnibus, this great vehicle for change, we ask, dear Lord God, that you recognize that 2, 3, a few more have gathered in your name. And so make our faithful demonstration a good work of salvation, of hope, knowing that when one member suffers, all suffer, and that when one member is honored, all are honored and share in that joy. And so let us honor the sanctity and dignity of life of both mother and child, and let the good work be done so that we may all prosper as your beautiful creations. In your name I pray. Amen.
Hi, I'm Jamila Taylor, Director of Healthcare Reform and Senior Fellow at the Century Foundation. Today, I'm going to talk about the history of reproductive oppression and the connection to maternal health. The Century Foundation is a progressive, independent think tank that conducts research, develops solutions, and drives policy change to make people's lives better. We pursue economic, racial, and gender equity across a number of policy issues. We were founded over 100 years ago by progressive business leader Edward Filene. So issues around reproductive health and maternal health can really be traced back to historical foundations of racism and reproductive injustice in this country. We see this really perpetuated in the lack of reproductive autonomy for enslaved Black women. The labor of enslaved Black women was exploited throughout this time period, and we saw dreadful practices like slave breeding, where slaves were forced to mate to increase the production of slaves on a given plantation. And then we also saw families separated, going from plantation to plantation, or other parts of the country, completely unfamiliar places, torn away from the people that they love. And then we begin to see experimentation of enslaved Black women and the study of obstetrics and gynecology. And you can read up on this as you read stories about people like the father of obstetrics and gynecology, known as Dr. J. Marion Sims. Through these experimental surgeries, he would force enslaved Black women down, oftentimes calling on other slaves to help him do his dirty work. Oftentimes, these surgeries were performed without anesthesia. The voices of enslaved women, their cries for help could be heard miles away. And then we move into the Jim Crow era. During Jim Crow, we saw an influx of lynchings of Black men and women, including pregnant Black women. For Black women who were raped by white men, they were largely gone unaccounted for, those rapes. And then we move into a time period where we see more of an institutionalization of racism through policies like requiring birth control as a condition of public benefits. We saw it through forced sterilization policies as well, where women were forcibly sterilized without their consent by those in the medical field. And then last but not least, Black women did begin to organize and call for their reproductive rights, as well as a host of other social justice issues. The US maternal mortality rate is worsening. Just this week, the Centers for Disease Control and Prevention issued new maternal mortality numbers for the year 2022. Black women are 3 times more likely to face risk for maternal mortality when compared to white women. We also saw an increase in maternal-related deaths among Hispanic mothers, an increase of 44%. And when we look at the maternal mortality rate of the US, we know that it far outstrips that of other industrialized nations. If you see here in this chart, the US maternal mortality rate is about 23.8%. And then even in the countries that come behind it, they're still vastly different than our maternal mortality rate. Racism drives poor maternal health. And we know this because research shows us that the cumulative stress associated with racism and gender oppression undermine the health of Black women. We also see that racism is fueled by predominantly white power structures that perpetuate and reinforce power imbalances and a lack of empathy and respect for Black women. This means that our solutions must be grounded in social justice frameworks that are intentionally designed to address these power imbalances. And that brings us to the reproductive justice framework. This framework was coined by a group of Black women in the mid-1990s at the International Conference on Population and Development. It is a human rights-based structured approach that addresses the intersecting systems of oppression that prevent marginalized people, primarily women of color, from achieving complete bodily autonomy and parenting with dignity. So when we develop our solutions through a reproductive justice lens, it means that we recognize a woman's ability to determine her own reproductive destiny. We recognize that reproductive freedom is linked to the conditions within a birthing person's community. And we center women and birthing people of color and their unique experiences. We also recognize that health outcomes and access to healthcare are central factors that cannot be isolated from other social issues like economic opportunity or exposure to violence and safe, affordable housing. So some key takeaways for today include the fact that historical foundations of racism and reproductive justice must be acknowledged. Reproductive justice centers women of color and their human rights to parent with dignity and attain reproductive freedom. Racism and gender oppression drive maternal mortality and morbidity among Black women and birthing people of color. And this means that our policies must be intentionally designed to dismantle structural racism and gender oppression that we see in various facets of American life. So if you want to learn more about reproductive justice, the history around reproductive oppression and racism, and much more related to maternal health, here are some suggested readings. We have everything here from journal articles to commentaries to books. And feel free to follow up with me if you have specific questions. This is why we do this work, for the moms and babies that count on us to be their advocates, the moms and babies who may not even realize that this country is in the midst of a maternal mortality crisis as is. Thank you so much for listening and enjoy the webinar.
Hi, everybody. I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I would like to thank the Interfaith Partners for Health Coalition for hosting this event and for the tireless work you are doing to end the Black maternal health crisis in the United States. As a co-founder and co-chair of the Black Maternal Health Caucus alongside Congresswoman Alma Adams, these are urgent issues for me, and I am grateful for your commitment to this sacred mission as well. I can trace my work on health policy all the way back to my childhood, beginning with a swimming lesson when I was 8 years old and discovered I had a heart condition called supraventricular tachycardia. The care I received during that scary time inspired me to pursue a career in healthcare, ultimately leading me to nursing school and my registered nurse credential. But as I completed my clinical education, I was also exposed to the world of health policy, and I came to see how I could apply my clinical training to improve health outcomes and promote equity through legislation that touches the lives of every American. I ended up joining the Department of Health and Human Services, working to implement the Affordable Care Act, and later serving as a senior advisor until the very end of the Obama administration. It was during that time, in January 2017, that my friend and graduate school classmate, Dr. Shalon Irving, prepared to give birth to her first child, a beautiful daughter named Soleil. Shalon, a Black woman, was a dual doctorate CDC epidemiologist who later served as a lieutenant commander in the U.S. Public Health Service Commission Corps and focused on health disparities in her career. She was so excited to be a mom, but 3 weeks after Soleil was born, Shalon died due to complications from her pregnancy. She was just 36 years old. When I came to Congress, I knew I would find a way to honor Shalon's legacy by carrying her health equity mission forward and taking on the issue of Black maternal health. And just 3 weeks into my first term in the House of Representatives, I was lucky to find the perfect partner for this work, Congresswoman Alma Adams from North Carolina, whose family has had their own challenges with pregnancy-related complications. For Congresswoman Adams, for me, and for so many of you, this work is intensely personal. That's why Congresswoman Adams and I co-founded the Black Maternal Health Caucus, a group of more than 115 bipartisan members of the House who share a commitment to raising awareness and taking action to save moms' lives and end disparities. The crisis in front of us is urgent. As many of you know, our nation has the highest maternal mortality rate of any high-income country, and the majority of these deaths are preventable. The pregnancy-related mortality rate for Black and Native Americans is 2 to 4 times higher than the rate for white Americans, and Hispanic and AAPI people also experience elevated rates of maternal mortality, morbidity, and disparities. This crisis is tragic and unacceptable, and it requires a bold, evidence-based response. That's why last year I introduced a sweeping legislative package called the Black Maternal Health Momnibus Act, which includes 12 bills to build on existing legislation to comprehensively address every driver of maternal mortality, morbidity, and disparities in America. The legislation includes investments to grow and diversify the perinatal workforce, address social determinants of health, improve data collection, provide funding to community-based organizations, and support moms with mental health conditions and substance use disorders. These investments and the others in the Momnibus will save lives and end racial and ethnic maternal health disparities. I was proud to first introduce the Momnibus with then Senator, now Vice President Kamala Harris in 2020, and I am thrilled to be partnering with her now to move these priorities forward. And in recent months, we've seen historic progress. In November, I was honored to go to the White House to watch President Biden sign my Protecting Moms Who Served Act into law, the first bill in the Momnibus to be enacted and an unprecedented investment to improve maternal health outcomes among veterans. Shortly after the bill was signed, a report was released that showed how some Department of Veterans Affairs medical centers have critical maternity care workforce shortages, an issue that is directly addressed by my bill. Thanks to the Protecting Moms Who Served Act becoming law, pregnant veterans and every VA medical center will now have access to the care and resources they have earned. And on the very same day that my bill became law, the House of Representatives passed another Momnibus bill with unanimous bipartisan support, the Maternal Vaccination Act, which provides funding for a maternal vaccination awareness and equity campaign to protect moms and babies against preventable diseases. On top of these milestones, every single eligible provision of the Momnibus was included in the Build Back Better Act that passed the House, along with a permanent expansion of year-long postpartum Medicaid coverage in every state, the largest maternal health equity investment in United States history. As negotiations on the Build Back Better Act continue in the Senate, it is essential that we prioritize these investments that families are counting on, and that's why I'm counting on all of you in the faith community. Stand up and speak out, make your voices heard, and contact your senators to urge them to pass the Build Back Better Act with the critical maternal health provisions that we need to end our nation's maternal mortality crisis. There is no time to wait. So thank you for everything you're doing on this important issue. And thank you again for the opportunity to join you for this event. I look forward to the day that I can be with you in person, but until then, take good care of yourselves.
Greetings. I'm Congresswoman Alma Adams, and I represent North Carolina's 12th Congressional District. As co-founder and co-chair of the Black Maternal Health Caucus, as well as co-lead of the Black Maternal Health Omnibus Act, I am honored to speak to you today. Thank you to Network Lobby for Catholic Social Justice, Network Advocates for Catholic Social Justice, and the Religious Action Center of Reform Judaism for organizing this event. Thank you to all the faith partners who have helped to bring us together today, and today's speakers and panelists for taking time to discuss Black maternal health and the Omnibus legislation. The maternal health crisis hits home for countless American families, including me. For me, all of this work began when my daughter Janelle, a Black mom herself, survived a complicated pregnancy that almost claimed her life after her complaints of pain in her abdomen were overlooked by her physician. Overlooking the pain of Black women in healthcare results from implicit bias and racism, and higher amounts of implicit bias result in lower quality of care. And while my daughter Janelle is still with us, how many people my age aren't as lucky and now have grandkids who will grow up without a mommy? This is why in 2019, I asked the youngest Black woman elected to Congress if she wanted to launch a congressional Black caucus focused on Black maternal health. And Congresswoman Lauren Underwood did not hesitate. We wanted to raise awareness, educate our colleagues, and shine a bright spotlight on the maternal health crisis of mothers needlessly dying during what should be one of the most joyous times of their lives. We stood up because maternal health outcomes are unacceptable. Sadly, our nation is one of only 13 countries in the world where the rate of maternal mortality is worse now than it was 25 years ago. And it's disturbing that across the country, Black women from all walks of life, regardless of socioeconomic status and education, are dying from preventable pregnancy-related complications at 3 to 4 times the rate of non-Hispanic white women. About 700 women die each year because of complications in pregnancy and childbirth, and 60% of these deaths are preventable. But how do we solve this crisis in America? Well, we center the most marginalized and impacted Black women and birthing persons. And that is why Congresswoman Underwood and I introduced the Black Maternal Health Omnibus Act. The Omnibus builds upon existing maternal health legislation by filling gaps to comprehensively address every dimension of the maternal health crisis in America to save lives and end racial and ethnic disparities in maternal health outcomes. This is just the start, and we will fight for a future where mothers and babies are given the tools they need for good health. One of these tools is healthcare. North Carolina is one of 12 states that has not expanded Medicaid, leaving many parents at a disadvantage. According to the Center for American Progress, closing the Medicaid gap could save up to 7,000 additional lives every year. If you want healthy kids, you need healthy pregnancies. And if you want healthy pregnancies, you need healthy moms. And if you want healthy moms, those moms need health care. As I reflect on the work we've done so far and the work that remains ahead, I think about my faith. Scripture tells us not to love in word or talk, but in deed and in truth. The Omnibus will save lives and yield a return on investment to change the outlook for American mothers and positively impact America's families well beyond our years. We know that key interventions included in the Omnibus can improve maternal outcomes for Black mothers and birthing people, because no one should have to lose another friend, auntie, sister, daughter, or mommy to this crisis. It doesn't matter what your political beliefs are. Either you have a mother, are a mother, or know women who are moms. And when we raise the tide for Black women who are among the most marginalized and the most vulnerable, we ultimately raise the tide for all women. The faith community is key to our continued efforts to pass the omnibus legislation. By amplifying the reality of Black maternal mortality crisis, advocating for the omnibus, and asking your senators and representatives to pass the legislation, you can make a difference. Please continue to be engaged and involved in the process of government because you play an essential role in helping legislators to shape public policy and make our nation truly live up to its highest ideals. Thank you again for inviting me to today. Let's pass the omnibus now because our mamas can't wait.
Hello, my name is Yolanda Savage Narva, and I'm the Director for Racial Equity, Diversity, and Inclusion at the Union for Reform Judaism, whose nearly 850 congregations across North America encompass 1.8 million Reform Jews. I am honored to speak on behalf of the Reform Jewish movement, the largest and most diverse Jewish denomination in North America. The Union for Reform Judaism is proud to support maternal health equity and the Black Maternal Omnibus Act. This bill is a necessary first step in eliminating health inequities plaguing Black women. These disparities are a direct result of the enduring legacy of the enslavement of African descendants and more than 400 years of systemic racism in the United States. Systemic racism has created an invisible caste system that determines where each person fits into a false hierarchy and places Black women on the bottom rung with devastating health consequences. We know all too well that the devastating statistics about maternal mortality in the United States are especially geared towards women of color. The United States has the worst rate of maternal death in the developed world and is the only developed country with a maternal mortality rate that has been steadily increasing for the last 3 decades. Black women in the United States die from pregnancy-related causes at 3 to 4 times that of their white counterparts, regardless of education, income, or other factors. Hispanic, Native American, Asian American, and Pacific Islander mothers experience disproportionate mortality rates as well. Guided by our Jewish text and tradition, the Reform Jewish movement is committed to advancing reproductive health equity and eliminating racial disparities in healthcare. In Judaism, the principle of pikuach nefesh, preserving life, teaches that human life has infinite value and that the preservation of life supersedes almost all other consideration. Our religious canon is full of rabbinic and biblical text emphasizing the importance of protecting the life of pregnant individuals. Judaism is also clear about our communal responsibility to ensure that healthcare is accessible for all people. Maimonides, a medieval Jewish scholar and physician, taught from the Torah that physicians are obligated to heal the sick. Maimonides also placed healthcare first on his list of the 10 most important communal services a city must offer its residents if the city is to be found worthy for a great scholar to live in. This shows us that the obligation to provide health care applies not just to the doctor, but to society as well. Congress must work to eliminate disparities in maternal health care. This is a matter of racial justice. As Jews, we believe that everyone is created in the image of God. Jewish tradition teaches that God created humanity out of dust from all over the world: yellow clay, white sand, black loam, and red soil. From this, we are taught that no one can declare to any race or color of people that they do not belong here, that this soil is not their rightful home. The maternal health crisis is both a racial justice and a public health issue. Congress must act to protect Black moms in America. That's why we're calling on the Senate to lift up maternal health, support Black maternal health in the Build Back Better Act.
My name is Raven E Freeman, and I have grown up in the movement for reproductive health, reproductive freedom, reproductive liberation, and reproductive justice. As a queer Black woman in this movement, I have shown up in many different capacities and many different roles. I now show up as a perinatal mental health professional and licensed clinical social worker, where it is my joy to support families as they navigate those pregnancy realities, as they navigate parenting and caregiving. And this is all centered in the experience of Blackness and the experience of queerness. In this growing up, I have landed at Mama Toto Village, where I serve as the Director of Policy, Organizing, and Partnership. Mama Toto Village is a community-based organization led by Black women, serving Black women, where our vision is healthy mamas, healthy families, and healthy communities. As an organization in Ward 7 of Washington, D.C., we are devoted to serving Black women through the creation of career pathways in maternal health and providing accessible perinatal support services designed to equip women with the necessary tools to make the most informed decisions in their maternity care. One of my joys of working with and at Mama Toto Village is that we center the values represented in the movement that spell out the acronym I Care Sis. These values are inclusivity, collaboration, advocacy, respectful care, equity, support, integrity and accountability, and service. I've grown up under the tutelage of Black elders who taught me to constantly amplify that it is Black mamas, and it has been Black mamas and Black birthing people with their Black babies building the transformative infrastructure that provides affirming care and support to add to the dignity of Black lives. If we had a little more time, I would tell you about my first experience doulaing, where the payment was a bartering arrangement. It was necessary to create that level of solution for that Black mama to ensure that they had the affirming care and support. It is my Black elders who taught me that it's an intersectional approach, which includes economic investments and environmental protections to ensure that Black mamas, Black birthing people, and Black babies can live a life where they are healthy amongst each other and within their community. In this effort, we are amplifying solutions centered in and from Black leadership. Most importantly, my Black elders taught me that the moment is not next. The moment is not soon and very soon, but the moment and movement is now. So it is now when we must pass the Momnibus package of legislation. These 12 titles ensure funding and research to tell the whole story of this present moment, named the Black Maternal Health Crisis. This crisis does not belong to Black mamas. It is not Black mamas who initiated the crisis, but it is us that rise against it and rise to address it. The Momnibus package ensures funding for community-based organizations like Mama Toto Village. It invests in the workforce, it invests in the environment, and most importantly, it is adding dignity to the experience of Black mamas and birthing people in every condition of life. This includes those who are incarcerated, those who live amongst historically underserved communities, those navigating substance dependency and recovery, and those those who have served and are our veterans. The omnibus package of legislation leads us to ensure even more critical investments in the infrastructure, in the treatment, and the payment for Black mamas, babies, co-parents, and caregivers. Momnibus is the now. It is necessary for us to ensure the passage of this legislation so that we are adding to the experience of Black lives, centering their solutions, centering their dignity, and centering our value. Can you imagine with me that if now is the moment and now is the movement, that this is the time to reckon against what we are calling the Black maternal health crisis? Can you imagine with me that when we begin to tend to this crisis by amplifying Black maternal health solutions made for us, provided by us, that we are winning? Can you imagine that when we win, we are returning this crisis to its rightful owners, the history of systemic and structural racism and misogyny in and around medical institutions? Can you imagine with me that we have won? And that in this winning, all Black mamas, all Black babies, all Black caregivers can reclaim their brilliance and the solutions that we have invested in us since the very beginning. When we have imagined and we have won, our placement and position in this movement will be to sustain Black-led community-based organizations so that their work is replicable for all else that Black families are told to bear. Will you imagine with me that we've won? What will be your role in this imagining? I can tell you that in Ward 7 of Washington, D.C., Mama Toto Village has taken to building that which of what we imagine. We are building toward the winning, and we are building our place in the movement. Mama Toto Village is investing now in our future to ensure that Black mamas and Black babies and their families have access to care, have access to support. In this building, we will provide services that add to the dignity of the Black experience. This will include a clinic where people can come and access the care that they most greatly desire. So if we acknowledge that the moment is not next, it is not soon and very soon, but the moment is now, will you take your spot in this imagining to ensure that Black-led community-based organizations are placed and positioned with investments such as the Momnibus package of legislation, with investments of your support, with investments of amplifying that it is not the Black maternal health crisis that requires our attention, but it is Black maternal health solutions that require our investment. I believe that we will win and that I will see you in this winning. Thank you.
Hello, my name is DONNA DEMIR, registered nurse here on behalf of American Muslim Health Professionals, also known as AMHP. I want to thank Faith United for giving me this opportunity to come forward and speak on something as pertinent as this legislation that has been written on maternal child health. So thank you for that again. Let me start by saying this topic is something that's very near and dear to my heart. My level of expertise as a nurse is women's health. That's my specialty. That is where I've been most of my career, taking care of women through labor, after labor, and then taking care of their children in the nursery. I've also done quite a bit of home visits. So a lot of these women are underserved and struggle. A lot of them did not have any prenatal care. They don't have cars. They don't have any hospitals near them. They get to the closest hospital, which could be quite a ways away from where they live. So I know this is personal, very, very personal to me. Just to read the statistics that women of color are 2 to 3 times more likely to die during pregnancy or after childbirth in America. something that really hit me quite hard. I'm a woman. I am a woman of color. I am a mother. I'm someone's daughter. I have daughters. And this is something that just shouldn't exist in a country as great as America. So what do we do about it? Well, what we do is we support this legislation. We know that in all of our faith-based traditions, health is life, and life is a God-given right. And we want to see women move forward, women stay healthy. We all should want for people to have the best that they can possibly have and be the best that they can possibly be. It makes me think of a very famous quote that all of us know: now is the time for all good men to come to the aid of their country. Yeah, well, now is our time. Are we not the more fortunate? Those of us attending this, those of us that are speaking, those of us that are medical, those of us that are professionals within our own right, are we not the more fortunate? So what are we going to do about this? Well, what we're going to do is we're going to support this legislation, and we should support it collectively as a group, because we are all human beings, and part of being a human being means you have to be humane. And I think that it's incumbent upon us. It's a responsibility, 100%. When I think of this also too, as a Muslim woman, I am absolutely required to offer assistance and take care of those less fortunate than myself. We read time and time again the rewards and the blessings you get for even bringing someone a glass of water. Just as that simple. It's just that simple. It doesn't, nothing is stated as to who that person might be, or even feeding an animal, a hungry animal, alleviating the burden of your fellow man. We have a very common saying in Islam that says, even if you hurt someone or if you kill one person, it's as if you killed all of humanity. So why not look at this the other way around? If you help one person, why is it not that you are helping all of humanity? We know this is true in our faith traditions. So this is something that we really, really need to consider. This is something that we really, really need to support. It brings to mind, with Black History Month just having ended, a very famous quote by Dr. King, and I'm going to read this for you. The most pertinent and urgent question is, what are you doing for others? And that is something that has been persistent, something that will carry us through all of our lives. What are you doing for others? We all know this, those of us that are of service. So I think what we really need to do is we need to support this legislation because also it's the right thing to do. Everybody deserves a chance. Again, health is life, and life is a God-given right. And everybody needs an opportunity to get a good start. You know, people need adequate health care. People need nutrition. People need comfort. They need attention. They need to be helped along the way. Another common expression is, but by the grace of thee. It could be me. It could be one of you. It could be any of us that could stand on the other side of this. It could be your daughter. It could be your daughter-in-law. You know, so as human beings, we really have an obligation, you know, to do the best that we can. Again, as an American and as a nurse, I just can't fathom that this is actually going on. So I think we should come together. I think we should support this legislation. And I'm going to share another quote with you, and I will close at that. A very, very famous quote by the great poet, Rumi. Rumi says, I want you to contemplate this. We are born of love, and love is our mother. So I think with this, we can go forward. We need to support this legislation. American Muslim health professionals feel very strongly about this. We certainly do. And we hope to meet you all in one one day in person when we get a little further on in this COVID. I thank you for your time, and I wish you all the best. Have a wonderful evening. Goodbye.
After all you have heard about Black maternal health today, we hope you can see why this legislation needs to pass this year in the budget reconciliation bill. I am Mary NOvak, and I serve as the Executive Director of Network Lobby for Catholic Social Justice. Catholic social teaching shows us we have a moral responsibility to guarantee access to healthcare for all, and that we must prioritize those who are vulnerable and suffer oppression. Our shared faiths all hold that the gift of life is sacred and extra care must be taken to protect mothers and babies when they are at their most vulnerable, particularly during and after birth. It is shameful that in the richest country on earth, Black moms are dying at the highest rate in the global north, and worse, that the rate is rising. As our speakers have shared, these disparities are grounded in historic denials of care and oppression. It is time to end this injustice. Change is absolutely possible. Historic investments in Black maternal health will save lives, build healthy families, end racial and ethnic maternal health disparities, and further birth equity in the United States. The Momnibus Act aims to do this by strengthening federal maternal health programs. We can fight to ensure critically important policies like the 12-month postpartum Medicaid coverage are passed to make sure moms and babies have access to the care and support they need and deserve for the full postpartum period. We can make sure critical investments in social determinants of health that positively influence maternal health outcomes like housing, transportation, and nutrition are available. We must prioritize funding for community-based organizations that are working to improve maternal health outcomes and promote equity. Together, this can be the year to end the disgrace of Black maternal death and improve the health and well-being of women, infants, children, and families. You must call Congress. We all must call Congress to pass Black maternal health legislation this year in the budget reconciliation bill. Together, we have the power to call forth the change we seek. Talk with your member of Congress and urge support to end the Black maternal health crisis now. Thank you.